February 1994. California, United States. 45 minutes after a woman entered the emergency room at Riverside General Hospital, she was dead. 27 medical staff collapsed. The hospital was shut down, and the air tested positive for chemical agents once used in warfare. And yet, something didn't add up. That night, only one patient had entered that emergency room. Her name was Gloria Ramirez. Years later, she would be remembered by a single name, the Toxic Lady. When she arrived, her condition was critical. She was severely disoriented, hallucinating, struggling to breathe. Doctors immediately administered powerful sedatives. They had no effect. Instead, her condition worsened. Her blood pressure dropped. She began slipping into shock. The medical team made a final decision, a defibrillator. The moment the electric shock was delivered, something no one expected happened. A thin, oily film began covering Gloria Ramirez's body, and from her mouth came a strong, unmistakable smell. Garlic. Nurse Susan Kane drew blood from Ramirez's vein. Inside the syringe, she noticed something strange, yellow-brown crystals. Moments later, she collapsed without a word. The syringe was passed to Dr. Julie Gorczynski.
I asked the nurse to start an IV that about coincidentally at the same time I smelled, ammonia. To me it was ammonia. And I kind of made a comment that, that's really strong ammonia. And I kind of felt, like I was going to pass out then. So I moved around to the other side of the bed to get away from the fume.
She collapsed as well. Pulmonologist Dr. Maureen Welch remained in the room. She noticed something else. The blood smelled like ammonia. The moment she inhaled it, she too collapsed. The situation spiraled out of control. The emergency room was immediately shut down. Patients and staff were evacuated. Amid the chaos, Gloria Ramirez went into cardiac arrest. After 45 minutes of desperate attempts to save her, she was pronounced dead. The official cause of death was listed as kidney failure due to cervical cancer, but her body was not handled routinely. It was double sealed, placed inside a steel container, isolated. The autopsy did not begin until 6 days later. Air samples from the emergency room were later analyzed. The results were alarming. Ammonia. Phosgene, a chemical weapon used in World War I. Hydrogen cyanide, a gas used in executions. Ramirez had been in the room for only 45 minutes, yet 27 medical staff suffered symptoms: nausea, breathing difficulties, loss of consciousness. Dr. Gorczynski later developed a vascular necrosis in her knee and required crutches for months. The Lawrence Livermore National Laboratory was brought in to investigate. They proposed one of the strangest theories in medical history, that a form of chemical alchemy had occurred inside her body. At the center of the theory was a substance called DMSO, dimethyl sulfoxide. At the time, some cancer patients used it as an alternative pain treatment. Ramirez had applied it all over her body. When exposed to oxygen from the mask, DMSO converted into DMSO2, dimethyl sulfone. This alone was not lethal. The real danger, they suggested, came from the defibrillator. The electrical shock accelerated chemical reactions inside her body, transforming DMSO2 into DMSO4, dimethyl sulfate, a highly toxic nerve agent, a common pain treatment, turned into a deadly chemical weapon inside the human body. Even so, the theory could not explain everything. The family rejected it. They accused the hospital of negligence, of hiding the truth. They believed toxic gases had entered the emergency room through the drainage system. About a year earlier, the hospital had been warned. Authorities had flagged the risk of toxic gas backflow through first-floor drains. As opinions clashed, Ramirez's body remained unexamined for over a month. Severe decomposition made further testing impossible. Critical evidence may have been lost forever. During press briefings, officials abruptly walked out. The lead investigator from the county coroner's office later took his own life. Gloria Ramirez was finally laid to rest on April 20th, 1994. But her family still believes the same thing. that the hospital was responsible for her death. This is Forbidden Atlas, a record of places that exist on the map but remain unexplained.